I'm Rick Solomon, a good friend of the 92nd Street Y. As the organizer of this program, I'm pleased to present this most timely and important event tonight. The pandemic has exposed a number of severe vulnerabilities in our public health infrastructure and the ability to prevent and manage the effects on Americans' lives. We will have an honest conversation tonight of what we know about COVID-19, where the federal and local response has fallen short, and the disproportionate impact on communities of color. We have an all-star lineup of panelists. Before introducing them, a few preliminary comments. First, this program is presented free of charge as a public service by 92Y. As you know, the venerable 92nd Street Y depends on supporters like you, who share their passion for compelling conversations like this. Your support is needed now more than ever during this continuing pandemic, with the Y shuttered. Second, attendees will be able to ask questions through Zoom's in-meeting chat function on the bottom of your computer screen. Now to our introductions. Dr. Kavita Patel is a non-resident fellow of the Brookings Institution. Previously, she was the managing director of clinical transformation at the Center for Health Policy at Brookings. Dr. Patel is a primary care physician in Washington, D.C., and also an NBC medical contributor. Dr. Patel previously served the Obama administration as Director of Policy for the Office of Intergovernmental Affairs and Public Engagement in the White House. As a senior aide to Valerie Jarrett, President Obama's senior advisor, Dr. Patel played a critical role in policy development and the evaluation of policy initiatives connected to health reform, financial regulatory reform, and economic recovery issues. Dr. Patel also has a deep understanding of Capitol Hill from her time spent on the late Senator Edward Kennedy's staff. She has an extensive research and clinical background, having worked as a researcher at the RAND Corporation and as a practicing physician in both California and Oregon. Dr. Patel, a previous Robert Wood Johnson clinical scholar, earned her medical degree from the University of Texas Science Center and her master's in public health from the University of California at Los Angeles. Dr. Janice Blanchard, MD, PhD, is a professor of emergency medicine at the George Washington University School of Medicine. Originally from the south side of Chicago, I am pleased to say where her family still resides and where I actually hailed from as well. She completed her medical degree from Harvard Medical School, receiving also a master's in public health. A Robert Wood Johnson clinical scholar at UCLA, Dr. Blanchard received her PhD in health services research from the RAND Graduate School. She is a mixed methods health services researcher using both quantitative and qualitative methods in her studies and has worked on a number of projects related to racial disparities in medicine. In addition to her research work and serving as an adjunct affiliate researcher with the RAND Corporation, she continues to practice clinical medicine in the emergency department in Washington, D.C., where over 75% of deaths from COVID-19 have occurred among Blacks. We are fortunate to have as our moderator James Hohmann. Mr. Hohmann is a national political correspondent for the Washington Post. He's the author of the Daily 202, the Post's flagship political newsletter, and the voice of its affiliated Big Idea audio briefing. Hohmann covered local news for the Post in the early 2000s and returned in 2015 after 6 years at Politico. At the Post, he has written extensively about the coronavirus pandemic. He has also previously worked at the Los Angeles Times, the Dallas Morning News, and the San Jose Mercury News. A historian by training, Hohmann grew up in Apple Valley, Minnesota, and graduated with honors from Stanford University. Please join me in a virtual welcome to our great panel. Thank you.
Thanks so much, Rick. I'll just give a little bit of background as to kind of what brought me to come here. And I have to say that I can't echo enough the value of the 90-second why for myself, as well as I think a societal good in terms of being able to be a place where people can have open thoughts and ideas of expression. And as we're learning from the recent events of this year, as well as years past, that is something that should be valued and treasured. And I will say, just on a personal note, this is kind of a bucket list of mine, because anytime I could make it to the 90-second why for a reading, or just in any way, I always did and always found myself better for it. So thank you, Rick, and to the hosts, and absolutely echo the sentiment. When James comes back, oh, there we go. Here, we've got him back. Thank goodness. I can moderate, but I can't replace James. It's not possible.
There we go. I'm unmuted. Sorry about the technical difficulties, and thank you for the introduction, Rick, and for falling off right as you were doing that. And it is really an honor for me to get to ask some questions of two of the top medical minds we have in our country who understand these hard issues and the intersection between them. And I'm excited to help facilitate the conversation and then to open it up to audience questions in later in our conversation. But I wanted to start because I think, there's obviously so much going on and the news moves a mile a minute, but by telling you the story about a woman named Marnie Zhang, she was the chairman of the St. Paul, Minnesota School Board, the daughter of Hmong refugees. And about a month ago, her father contracted the coronavirus. She took care of him, in the process contracted COVID-19 herself. She ended up in critical condition, and earlier today, she passed away. She was 31 years old. So this is a very active, this contagion continues to be with us. Our Washington Post tracker shows as of this hour, we have 108,983 confirmed dead of our fellow Americans, with 1.93 million infections, more than 400,000 dead globally, with more than 7 million cases. So these are more than statistics. And as Rick noted in his introduction of Dr. Blanchard, African Americans have been disproportionately affected, especially here in DC, but everywhere. The data show that Black counties, or majority Black counties, have 3 times the rate of infections and 6 times the rate of deaths as their white counterparts. And so again, these numbers are staggering, but it's important to humanize them, and I hope we can do that a little bit tonight. Obviously, everyone wants to know when they're going to be able to go back to work, or when their kids are going to be able to go back to school, and what's going to happen, but I think a lot of the unrest that we're seeing, which we're going to talk about, is tied to a lot of the frustrations about all the systemic problems that we have, racism and police brutality, and those manifest themselves in the medical space. So I wanted to start with Dr. Blanchard, since you really are on the front lines, in the ER, in the hospitals here in Washington. And I was hoping you could just sort of get us started by talking a little bit about what this process has been like, what the last few months have been like, and what it's like kind of right now. Is it feel like it's calming down? Does it still feel like a daily deluge of incoming? What's it like?
So first of all, thank you so much for inviting me to speak tonight. This is a really important topic. And it's still there. With all of the other things going on, you forget about COVID. Right now, with the protests, it almost seems like a bigger issue. But COVID is still there, and it's still disproportionately affecting our communities. The big first wave was among Blacks and nursing home residents, and we saw so many deaths among that group of patients, but it's still there. And it's been really demoralizing in terms of being a provider, taking care of Black and brown patients that are dying from COVID every day. And it's also been really frustrating seeing our political leadership not respond to some of these issues.
Dr. Patel, you are advising companies and governments and others on this process of reopening. And what kind of advice are you giving them right now?
Yeah, it's a great question. I think most people are trying to wrestle with the fact that in order to reopen the economy safely, they want people to feel like they can come into their place of work and be healthy. And I think a critical piece of this has become, unfortunately, around testing. And I'll just kind of comment, just to give a little context. The United States had really been very obviously woefully behind in being prepared for all the testing we would need, everything from the swabs, which we've all heard about, and shortages. But I think we still have kind of an untold story about having responsible testing infrastructure. So businesses or schools are probably even a better example, where we are really trying to protect some of the most vulnerable people, young children who may or may not be able to follow some of the guidelines as rigorously as adults can. There's a debate about how often to test. The CDC has this guidance. And I will just tell you, I think that most people are not sure how to approach reopening schools, businesses, economies. And so you've seen a whole slate of businesses tell people that for the rest of the year 2020 you can work from home. I try to separate this out from what I'll call essential workers, which include restaurant workers and people who depend on their livelihood to be face-to-face, and they can't work from a Zoom or have the luxury to do that in many cases. And for those workers, I think there's a tension between offering safety as much as an employer can. And one thing that's been occurring to me, James, that's unusual is that most employers don't get into healthcare as much as you would expect them to. And part of how I've opened conversations, and I'm trying to do this more to advocate that the health community and the business and the economic kind of drivers of the United States work together. So businesses have, in order to work well, have to take on this kind of role and responsibility that's somewhat uncomfortable around health, being responsible for healthcare, but also knowing there's risks. So that just one kind of to give a little more also of a color of what's opening. Disney, which has reopened their theme parks, one of the biggest kind of tension points was with Disney was, would infrared monitoring of temperatures be enough? Well, if you look at the weather in Orlando, I mean, you can reach 110 degrees on a humid day. So it can't be enough to just do temperature monitoring. Symptom monitoring, well, that can also be flawed because we know like 1 in 4 people might not have symptoms. And then finally, again, the infamous testing issue. How could you stand up enough testing to do something to make people feel safe? And I think that's just a great conundrum, because we want Americans to be able to vacation and go to school. But I'll say this, I worry about the second wave, and I think I've been trying to think through policy, which can actually brace us for this new normal and how we deal with the fall, including schools and what that might look like.
Yeah, and I definitely want to talk about the second wave, but we're in this obviously historic moment right now. Today is the 10th day in a row that we're seeing massive protests in the streets here in Washington. Tomorrow is the 2-week anniversary of the murder of George Floyd. But we also got breaking news tonight that a protester in Lawrence, Kansas, who did not wear a mask to one of the protests, has tested positive, was at that protest, for hours. The county public health department there, that's where the University of Kansas is, has asked everyone to self-monitor for symptoms. Obviously, one of the nightmare scenarios here is that this disease that's already hurt African Americans so much could end up hurting the community more because of everyone who's been out protesting. Dr. Blanchard, what advice do you have for people who are asking you, is it okay to go protest? And how worried are you that this could sort of hasten a second wave now rather than later?
So this was a really big source of conflict for me. I've been a big advocate of the public health recommendations. I've been almost obsessive with sticking to them. I wear an N95 at work for hours on end. And so I struggle with this because, we have this COVID, but then we have this huge issue of racial injustice. And it's really hard to get people to be quiet during this time. You know, people really need to get their voices out there. And I even struggled with this myself. Yesterday, DC had some of the largest protests we've had thus far. So I think there are some steps that we can take. Obviously wearing a mask, trying to do socially distant protests is really important. We have to remember that COVID is still out there. It's not on the news a lot, and I feel like it's almost taking a back seat on some of the news cycles. So I do hope that we will still have that awareness and that public health leadership will remind us of the steps we need to take. So, you know, wear a mask, socially distance, wear goggles or glasses if you have it, and then hand sanitizer, you know, and shower and be really careful still. But it is hard to tell people to stay home.
And join something that Janice did and some of us have done, go with people you know, in terms of at least trying to have like a smaller group with lower risk, or at least trying to identify kind of lower risk. I know, Janice, you said you stayed on the periphery, for example, just to try to avoid being kind of in a social distance area. And then I can't help but say that, James, like in Philadelphia, and I think in other cities, there are people on site in the protests offering testing. So, you know, that I think those are just very practical ways also to be aggressive instead of what the Department of Health and Human Services said, which is, well, some of the protests are taking places in areas where testing is occurring, so they've had to close the testing sites. We have to flip that narrative and acknowledge that we should be where people are. And if people are in the protests, we should be kind of, as public health officials, we should be present in those places to at least tell people how they can minimize high-risk contacts, or if they have people at home that they're worried about infecting, how could they minimize contact with them until they can get tested? And you're seeing some of the cities doing that pretty aggressively.
Kavita, can you kind of compare how you see these protests versus sort of the Liberate Michigan protests where you had all those, you know, people out storming the state capitals that we saw kind of 6 weeks ago now? Why are those kind of substantively different?
Yeah, I know that both Janice and I kind of feel the same way, that a lot of people want to kind of make a point. So I'll say this, even then, and actually now, I would say there's a healthy way to do this from a public health kind of standpoint. Everything Janice said, and trying to actually offer some form of ability to express yourself, but maintain safe distance and low risk. With the first wave, James, and by the way, I have flashbacks because it reminds me of some of the protests against the Affordable Care Act, where people were picketing in town halls that I had to go to, where they said, keep the government out of my Medicare. And it reminds me a little bit of that, because you had people protesting, saying that these stay-at-home rules were, or they weren't shelter in place, they were stay at home. There is actually a technical difference, but that these stay-at-home rules were violations of their freedom. And with the murder of George Floyd and Breonna Taylor, and I mean, the list unfortunately goes on, but with the murders in these recent protests, it was the ability to protest was in order to be alive. And so on one hand, protests, both protests, I would say the same thing. If you want to express yourself, that's what the United States is for, but there was very little regard of how to do so safely. And in this case, and Janice, I'll kind of invoke you. The other difference is that you actually had health professionals, you had frontline workers who also felt that there was something different about the kind of the genesis of why people needed to get out and be heard. But at the same time, what you're seeing now are people wearing masks, not everyone, which is why I think you'll see some increase in cases, as you mentioned in Kansas. But you saw, for the most part, people really trying to adhere to doing as much as they could to be safe.
And what, Dr. Blanchard, what's your latest thinking on what do we know about the virus, outside, in the heat, in the humidity? Does that make a difference? Is it safer to be outside in a crowd? Obviously, you still want to socially distance, but are we getting any data on that? Obviously, this is a kind of a large test case in some ways, but
Mhm.
Yeah, I think it's being outside helps, but you still want to wear a mask and you still want to socially distance. I mean, a lot of the cases we've been seeing are people in close quarters. But if you just go back to the 1918 influenza pandemic, you know, there was that big Philadelphia World War I parade, and then there was a spike in cases afterwards. So it's still a concern, without a doubt. It's still a concern that we might have a spike in cases, but definitely being outside with the mask and socially distant and trying to socially distant, I think will help certainly, but you still have to be careful.
And James, we are seeing an increase in cases. If we go to parts of Texas, Harris County, certainly people have kind of heard about Los Angeles, and what you're seeing is a pattern emerging where what the increases that we're seeing now are actually the result of some of the earlier kind of phased reopenings. And remember, like with most kind of viral infectious diseases, there's a bit of a lag time, so it's usually several weeks. So despite kind of, you know, what might seem like, well, the numbers are going up now and we have these protests now, those are really reflective of what I would say are kind of patterns pre-protest. And again, you know, even if optimistically we have 20,000 new cases a day, which is kind of what we're at, and if we go to about a 5% positivity rate, meaning 5% of tests that are being done, we're doing about 2 to 3 million tests a week, a lot more than we ever did, but it's about 5%. We're still seeing quite a bit of coronavirus. To your point about that eloquent story from the person the family that you spoke of, it's a real threat. And I worry a little bit that I think our nation is just tired of being at home. We're tired of being on Zoom. And I think we're desperate to get outside, and we're willing to kind of turn a blind eye to it. And I worry a little bit that this just sets us up for kind of a worse fall. That's my fear.
Yeah, and I mean, what I worry about is, you know, there was a video that went viral yesterday of Las Vegas, and you know the casinos have reopened, and there's all these people gambling, and it's crazy, and I worry that, you know, we're going to see the protesters blamed for kind of some of this resurgence, when in fact it's some of that in many ways riskier behavior.
So James, can I ask you, since you, so I'm going to go ahead and do what might annoy kind of any moderator, but you really you have reported not just on this, but I think on the presidency, you've reported on the Trump administration, as well as kind of, you know, just reflecting on past presidents. How, just being objective and knowing that we have to kind of work forward, we cannot have the unemployment rate continue. It feels like we're cratering economically. What kind of advice, how do you think about this when you think about critical times in history? And I can't think of one kind of in my lifetime that is of this magnitude, and that's why we talk about this being a once in a lifetime event. But what kind of advice? How do you give like the country a way to move forward if you were one of the president's daily briefers, a counselor to the president, kind of a close advisor?
Yeah, what I really worry about is that the president has his eye off the ball. The White House has made a strategic decision looking to November to stop talking about the coronavirus. The president, you know, I think has moved on in his head and isn't addressing it. The coronavirus task force, which initially they wanted to disband, but they backed off from that, was meeting every day. Now it's meeting 2, maybe 3 times a week. The president hasn't had a FaceTime with Dr. Anthony Fauci now in 3 weeks, which is kind of seems really crazy. The Admiral Brett Giroir, who's in charge of the kind of the testing coordinator for the coronavirus response, he's going back to the job that he had at HHS before. You know, I think a lot of this reflects wishful thinking, that if you sort of stop talking about it and stop paying attention to it, then the problem will go away. But that's how we got this mess in many ways in the first place, and became the epicenter in the world of infections and deaths. And so I think we're seeing it have a consequence. There was an NBC Wall Street Journal poll that came out today that showed more than 1/3 of Republicans no longer believe the coronavirus poses a threat. And so I think the fact that we're not seeing presidential focus and presidential leadership on this conveys a false sense to a lot of people who follow our leaders closely for cues that it's no longer a problem. And so just because the president's not talking about it doesn't mean it's not a problem. I think, to Janice's point, that's one of the reasons that we're seeing it less in the news, because the president has such a bully pulpit. So when he's not having news conferences to talk about it, or he's not doing some kind of messaging event around the coronavirus, and then obviously the protests, but that sort of means that it falls to the back burner. But that's why it's so important to keep reminding people that this is really a very real danger to them, and especially because the response to this we've seen over the last couple of months has become so tribalistic, and it's very worrisome, the degree to which wearing a mask is now kind of like is some kind of test for whether you're a conservative or not, and I think that that's particularly dangerous, and that's where the lack of presidential leadership is causing real public health problems for their core supporters, and so there's no question that this is going to continue to be kind of the main issue, I think, going into the fall in the election. And I think there's been quite a contrast between I think one of the things we saw from Joe Biden was that he was kind of saying, I'm just totally going to follow the public health advice. And he was in his basement. Tomorrow, he's actually flying to Houston to meet with George Floyd's family and go to the memorial service there. You have to do that to some degree. You can't, we're all stir crazy. You're absolutely right about that. And so, but it's balancing kind of the taking responsible risks and being thoughtful about it. And I think that that's the right solution, rather than just pretending like the problem doesn't exist and hoping that it goes away.
And I'll compare, I can say this, H1N1 wasn't something of anywhere near this magnitude, but we didn't know that. And it was probably, for me, the most recent kind of memory about a potential pandemic and how this might play out. And I'll just say one thing, giving credit quickly, the Situation Room and all the, not just the heads of healthcare, but kind of everybody who mattered in the administration came together every single day for Situation Room briefings that the president would sometimes attend. But at a minimum, after those briefings, Richard Besser, who was then the acting director of the CDC, who I think did a phenomenal job, he would hold press briefings where he wouldn't stop until every last question was answered. And it's such a contrast to me, where we heard, you saw, as you mentioned, on the daily coronavirus kind of task force, where you had the president at the lectern, and it felt like he was trying to own this somewhat. But I felt it was only after, honestly, it felt like in the beginning, he's like, well, 15 cases, it'll be down to 0 in no time. And then when we got reports after reports, and Janice knows this because nursing homes became the hotbed of this disease. And it seemed even then like the administration just didn't put a priority or care. And honestly, it felt like it wasn't until some of the president's closest friends and advisors and confidants actually started expressing concern, or had family members or friends getting sick, that you then suddenly saw this kind of wheels in motion. And so I've had to think about what could we do. Like, the people at the CDC, who I know, Janice knows, are amazing people. How can we bring that voice back, and how can we reclaim like the message of public health, and since then like trust? And I don't have like a great answer, but I think that it's if anything, my heart wants to believe that science can help us in many ways, but it does feel like there's a politicization of the science itself, even the hydroxychloroquine and all of these things that now have become so lightning rod, and they have no need to be. And just anyway, so I'm curious, because I thought if you were in the room kind of giving the president or even Joe Biden advice, how do you move ahead? How do you get faith back in the faith back in
I do think it's important that the CDC, I feel like they have been silenced.
Mm-hmm.
And largely because of leadership. And then when we don't, in every other instance, doctors, we respond to CDC recommendations. Lately we see the CDC recommendations and we're like, oh yeah, I knew that, I've been doing that already.
CDC recommendations are weeks behind.
Yeah,
they're weeks behind. Right.
Yeah, so part of it is they're silenced, and when you don't have that leadership from public health agencies, then you have disinformation, and everyone is coming up with all of these different recommendations that aren't science-based. So we really do need their voice. But right now, most of the things that are coming out, we know. They are definitely behind.
I'll say this, we get more clinical. Janice is in the ER and I'm on the primary care side. I get better clinical information from Twitter, candidly, because while things were unfolding in Italy, Janice, you saw those too. We were seeing what like the Italian doctors were tweeting, and we weren't using that to kind of change clinical guidance, but it was really helpful in real time to know how patients were being treated in other countries. And that, we need a way to have information given that is reliable, and that the CDC does usually have that role. And I hope that can be restored going forward.
I also think messaging, for as physicians, I can read Lancet or JAMA, but then I'm trying to actually tell a patient, I'm trying to tell people, okay, when you go to a protest, you need to wear a mask. And we need some kind of bond that helps us communicate better. And again, that's traditionally from the government, that's from the CDC. So that is really important, not just as doctors, but also messaging for the public.
Mm-hmm. We might have froze James. Oh, good. This gives me a chance to ask Janice. Janice, you and I were talking before this about nursing homes and just some of the patients. And I certainly have, when I've had to either take care of patients in the nursing home or admitting patients to the nursing home, I knew how kind of strenuous those circumstances were and those conditions. It is incredibly hard. Most nursing home workers, people have this notion that there are doctors and nurses inside of nursing homes on kind of a constant basis. The truth is that the majority of people taking care of patients inside of nursing homes are aides, and they've gone through some training. They're mostly women of color in general, and paid literally the minimum wage or kind of the lowest wage with an incredible amount of work. So I was not surprised, Janice, and were you with kind of hearing that potentially a third of the deaths were from, maybe more, were from nursing homes? And does this make us think differently about what we're doing in America with people in kind of long-term care settings? How can we use this as a moment to really evaluate like what are we doing wrong? Is it's to me, it's also a sign of just all the broken parts of our system.
So no, that's a really good point. Actually, 40% of deaths from COVID are in nursing homes, and actually nursing homes that have more Black and Latinx residents actually have even more deaths. I had one day where I went to work, this was at the peak of the pandemic, where literally every single patient that came in was a Black nursing home patient with COVID, and they were just so incredibly sick. And I went home and I was just felt hopeless. So this is a chance to make some changes. A lot of when you look at the nursing home distribution, Black and Latinx patients tend to be at nursing homes that are more crowded, have more beds. The people that work at the nursing homes tend to be people of color as well. So I think we do need to think about a lot of, I heard these stories where people didn't even have the right personal protective equipment. So they're taking care of people in the nursing home, these crowded nursing homes without good PPE. So this is a chance for us to think about how to redo long-term care, really encourage more, take healthy aging, right? Aging in place. And how to do that, not just for, the richest communities, but for all people.
Yeah, and I'll say for me, again, this is titled Politics of the Pandemic. I can't help but think of the politics around just whether healthcare, full disclosure, I think of healthcare as a right. And because I approach it that way, it's kind of made me feel like I'll be honest, even some of the movements around Medicare for All really resonate with me, because I start to feel like people need some sense of security. And I think COVID has shown us that if you don't have health security, you can't have economic security, you can't have educational security, you can't have mobility to feel like you can do something, right? And a lot of people talk about the elderly there's a very large population of young people with disabilities and chronic conditions and people that are not able to necessarily put themselves in risk, and also need the safety net of the healthcare system. So I'll say Janice and I both work and have worked at large hospitals. I think we share some blame in why things have kind of come to where they are. We have probably, I'll speak for myself now, the politics of healthcare has gotten so much that, profits have kind of overtaken what are basic functional elements of what people deserve, and copays, surprise billing, and a lot more out-of-pocket costs have created an environment where it's really hard to get high quality healthcare. And if you look in Washington, D.C., Janice and I both know we can drive 1.6 miles from the richest part of town to the other side of that diamond of Washington, D.C., and there's like 3 primary care doctors per 10,000 people in Black communities on the river versus 1.6 miles away. And why is that? It's because we can make more money building hospitals in more affluent neighborhoods that are insured by commercial patients, and margins on surgeries, and a lot of things that are, I think, kind of unspoken. And so I think that in order to kind of go forward again in kind of building blocks for what we need to do to move ahead, we have to also look at kind of not just systemic racism as a public health issue, but also think about the infrastructure of our very healthcare system. And I've been a big advocate, I'm a primary care doctor, I've been a big advocate for like, how can we flip the pyramid a little bit and put as much into community health centers and safety net clinics and places that are trusted by communities of any color, of any education and race and gender identity, and get that to be a trusted source. And just in thinking about the fall with COVID, and Janice, I just want you to react to this. And thinking about the fall, we can have testing, we can have tracing, we can have isolation, those kind of pyramid effect of how to deal with COVID. But I think we're gonna have to have like our emergency room doctors like you and primary care doctors like me. We're gonna have to have our ability to send out proactive messages around how to avoid COVID, how to get your flu shot or your pneumonia shot. I'm really worried a lot of people are just not gonna come in. And we're already seeing kids that we've seen the evidence, Janice, you've seen it too, the decline in vaccinations in children. So, we're unintentionally triggering another kind of set of hotspots in an area we didn't even plan on,
No, I think those are all important issues. And I also think we need to think about the social determinants of health. I think we focus a lot on the healthcare infrastructure, but I think that the COVID pandemic has unmasked the fact that social determinants are so important, right? If you don't have job security, then you're gonna work during a pandemic. If you, live in a place, an apartment building, or an apartment with 8 people, you cannot, or in crowded housing conditions, you can't socially isolate. So I think we need to go beyond just thinking about healthcare solutions. We need to think a little bit bigger in terms of how to fix the social determinants. But I think James is back on, so I don't know if we want to go back to him.
I was doing a very poor job of moderating. Like, I'm just talking.
Or maybe he's not.
You might be. No, you're muted, James. Oh, hold on. He's trying to unmute.
There we go. Now I've been unmuted. Yeah, sorry about that. I never have these technical problems. But Dr. Blanchard, can you talk a little bit more about what systemic changes are needed to deal with, obviously, if you have diabetes, you're more likely to kind of have an adverse impact, and that is its own, there's a whole host of things. And then I do want to talk more about the vaccine and looking forward, since you just mentioned some of your concerns about the fall. And then again, we want to open it up to questions in a minute. So you can write, if you're watching, in the chat box, some questions, and we can pose those to our amazing panelists. But Dr. Blanchard?
Well, it's hard to do this in a short time, but we focused a lot on things like diabetes and hypertension and those things in the patient that increases your risk, but there are also a lot of bigger systemic things. There's implicit bias in terms of how, in the healthcare system. And then there are things like I mentioned, social determinants of health. Those are all things that increase your risks of having hypertension and diabetes. These are all things that increase your risk of getting the disease and also dying from the disease. So these are things we cannot, ignore. And we really need to take a health in all policies approach and when we move forward, and we need to improve health, not just from the healthcare system, but really from all different government agencies.
And we can do that. So something that comes up, I keep interrupting. I'm sorry. I just get Janice and I could spend days giving like a master class on all the things we do wrong in healthcare, but how to fix it. I often hear from kind of governors that putting more money into healthcare takes away from education and some of these other kind of budgetary needs. And I think Janice's point, health in all policies. So the idea is not to cannibalize from one to the other, but to actually kind of create an adaptive learning environment where, as we're seeing right now, you can't have like a good, in fact, a friend of mine, Josh Sharfstein, who is one of the deans of the School of Public Health at Hopkins, he told me a statistic that startled me. 1 out of 3 cases of child abuse get recognized in schools. So if you think about like a state budget for education getting slashed, think about kids that aren't going to school right now, cases of abuse we're not picking up, but those are jobs that teachers are doing without any recognition. So I candidly am of the set, we have a lot of waste in healthcare. We need to reduce that waste, and we need to apply in all sectors ways to think about health. And I think Janice is so right. It's called kind of, health in all policies, but this is the right time with COVID to actually put those into place. Every state governor that I can think of is now going to be looking at a budget cycle with unemployed coming into Medicaid and all their budgets just getting drained because of COVID. This is actually the time to do it, not defer it, not wait 5 years until the economy recovers. Double down on it now, because I think it could actually help us.
Yeah, we also have all these people who now will have a need for insurance. We have all these states that don't have Medicaid expansion, where COVID is just still on the rise, and now more people that will need this public coverage, but yet we don't have that safety net for them. So there's so many ways we could go on. We should have a follow-up session to go on of all the things that we need to do going forward.
Well, one of the things Janice and I'll put a plug in, we're going to try, coming out of this, we saw that especially women and voices of color, like especially if you look at the upper echelons of medicine in general, corporate boardrooms. And I give a lot of credit to Rick and Susan and kind of the sponsors at the Y for seeking out voices of diversity. But we kind of have to start from within. We have to make sure that voices are heard. And if anything, I'm actually optimistic for the first time in a long time that we can make that happen, and that it's no longer going to be kind of ivory towers, and we need to get this message out, and it needs to be by engaging, the mom of 4 who works in a nursing home and gets overtime 60 hours a week, or the meatpacking employee who knows that she's going into an unsafe working condition, but does so anyway. And I think we can learn a lot from, James, frankly, from your reporting. We look at them as anecdotes, but they speak to everything we're talking about. We've just never been able to lift that to a level where we have, legislative change, policies, people in the Oval Office who talk about this in a very real way.
Yeah. Kavita, can you talk about the vaccine? Obviously, we have Operation Warp Speed. And maybe that's a little wishful thinking. Dr. Fauci said he wishes they wouldn't have called it that because it makes it sound like they're cutting corners. And it also, most folks don't think that the kind of the goals or that are being announced are realistic. But what is, we all want the vaccine sooner than later. Where do things stand? How optimistic are you?
Yeah, let me just do again, like kind of, I feel like I have to often explain things the way I would want them to be explained to me if I weren't kind of steeped in this. So vaccine development is actually better than we would have expected, only because people are using kind of what's SARS-CoV-1 or H1N1 or the Ebola or MERS kind of problems where vaccine manufacturers had developed unsuccessfully vaccines for Ebola, SARS-CoV-1, et cetera, H1N1. And so these molecules that were already started targets, some are kind of virus vectors where they fool you into thinking that you have COVID, the body, and create an immune response, or some target the RNA, the actual genetic material, to fool you into creating an immune response. So manufacturers have been a little bit getting kind of a leg up. Having said that, there's probably about 5 large pharmaceutical manufacturers who are the lead contenders for developing vaccines. Unfortunately, so a normal vaccine, phase 1, phase 2, phase 3, kind of safety trials, all of that is getting truncated to try to get a vaccine out in a year or less, which has historically, never been done. The fastest a vaccine has been developed is 4 years, but on average, a vaccine takes 10 to 12 years to develop safely. So this is truly just, one, it's unprecedented. And then number 2, what you're seeing right now about headlines around 100 million doses or 200 million doses, you can order vaccine doses from what molecule is currently being tested in phase 1 or phase 2, which are all just to look for safety or body immune response signals. But that doesn't mean that you, James, can drive up to a CVS and get a shot in the arm. So I think that just to also be clear, if you look again also at the H1N1 analogy, there were vaccines developed within, there was a kind of a record-breaking year pace to develop a vaccine similar to Operation Warp Speed. But even those earliest doses were only for frontline people or military. And I would predict same thing. If we actually saw a somewhat safe vaccine this fall, there's no way that it's going to translate to every American getting it. It'll still be prioritized populations. And one of the biggest gaps that the NIH, that I would say anybody should keep their eye on, is that we have to figure out how to evaluate what we're calling challenge communities. So in order to accelerate this testing, you have to give doses to tens of thousands of people. And that means that the very communities that don't trust anybody anymore because they don't even believe what's coming from the White House or in the newspaper or on social media are the very people that you're going to try to say, hey, sign up so that we can test this vaccine, you know, wink, wink. So the NIH is going to have to try to do that with these pharmaceutical partners like next month in July. So this is going to be, Operation Warp Speed is right. I will say cynically, I don't think we're going to see something for most people until the spring or summer of 21.
Well, someone, Kit Ballum-Cohen says, Dr. Patel for President 2020.
Kit is not, I have not, Kit, we're supposed to keep it on the down low. I'll give you the, she's not supposed to know that you're a friend of mine. No, just teasing. I often tell people, your best job is to work for the president, not to be the president.
Well, let me pose a question from Annan Carbonell, who asks, and maybe Dr. Blanchard, you could take a whack at this, because it fits with the vaccine and the availability in the fall, and obviously we are all stir crazy, but Anna asks, when can we start feeling safe enough to visit with family and friends? And, you know, is it going to be until we have the vaccine and all that entails? Is it going to be when the testing gets scaled up, or what do you think it's going to take?
Well, that's tough. I think a vaccine would help. I think if you're going to go visit family and friends now, you should still be outside and wear a mask. And I think you still need to take precautions until there is a vaccine, or you have some, we don't even know if the antibody, you know, we are looking at antibody testing, but we don't even know if the testing protects us. So if you visit friends now, please still socially distance, go outside. If you have food, maybe have separate food containers that you eat from. You still need to take all the precautions that you have done. And I think that's going to go on for a while, especially if there's a second wave later this year.
James, I saw the thread in the chat about different kind of immune compromise and different groups. I think, let me just say, kind of building on what Janice said, I would just practical, because I would say practical advice, if you have any sort of immune compromised status or just concerned about how to, I say you have to weigh the risks with the fact that I think people's mental health have been suffering from kind of staying indoors and being scared. I see it with children. I see it with people who are immunocompromised, and I think they're incredibly nervous about going out, rightfully so. But I also think that because of what I just told you about a vaccine, which by the way, it's very rare to find a vaccine like polio that's so effective. So in all likelihood, a viral vaccine will not be 100% effective or might require multiple doses. And so in that case, I think you do have to take precautions, but Janice, I echo your advice about just getting outside and having a way to engage with humans. It's not normal to just be inside all this time and not see people physically. And then I think that you should start thinking about kind of a virtual household. There might be another household or another person that you know is also either low risk or no risk. And if you're immunocompromised, you will still wear a mask, ask them to wear a mask, but you might decide that they might be the person that you have more social gatherings with, that you spend time on their patio. And I actually think that's going to be kind of this new normal for a while. And so same thing with schools. I think you're going to see schools reopening cautiously in the fall with smaller classrooms that are in shifts. And we're going to have to keep the kids together so that if there is a positive case, we can isolate them quickly. So parents of school-aged children, you should be prepared to have kind of a different fall, but I do think they're going to try to reopen. And then travel, I get a lot of questions about safety of travel. If possible, obviously kind of traveling in your car and controlling the circumstances is better, but air travel, the airlines are not all created the same. I've already had people tell me that some airlines feel like they're going through the reality of cleaning every site, and also middle seats are being emptied, and you should make sure that that's actually possible. So safety, I would say if you are immunocompromised, I would not be the first to try any of these things, but I would strongly think about how to protect yourself. And if you're like me and immune intact, you also don't want to be the first to do these things because you want to wait and see what the risks are.
Joel Nitskin asks, should we be encouraging people to secure more effective masks and beginning efforts to generate enough N95 compliant masks so they can be readily available, or are the coverings that people are wearing good enough? Obviously, those protect other people as much as yourself, but Dr. Blanchard?
So the masks actually, like you said, the masks protect other people from yourself, and we still need the N95s for healthcare workers. Obviously, in a perfect world, if they could have unlimited N95s, and N95 is the best way to keep yourself from getting it. But if you are in a group and everyone has their mask on, then your risk of getting COVID is actually pretty low. So it's not just, if you can actually get everyone else to be compliant with that and socially distance, then you would be fine.
And that was the masks, the PPE was a whole other political maelstrom that was kind of, candidly, like, why was it that we didn't actually use our SNS, our strategic national stockpile, to replete masks? Why did we actually have FBI agents blocking hospital administrators at airports from picking up masks from other countries when they had no ability? Why did we not invoke the Defense Production Act, or when it was invoked, why did we not use it? So I still think, honestly, James, I put this on your shoulders. I think it's been one of the few times where we need crystal clear, candid reporting. And I'm hoping that there's some form of after kind of, a more effective 9/11 commission. That sounds terrible, but something that has some teeth to it, because there's still a lot of questions that have not been answered and are not acceptable to me. And I don't feel like we're ready for a second wave with PPE, Janice. I don't think that we have the reliability to think our supply chain issues have been covered.
I was going to say physicians still aren't really well stocked with PPE.
Right.
We don't just have it everywhere. We burn through the gowns. We still restrict the use that we have because we are all really worried about running out of PPE at work. So it's not that we have it, we're still very short in the medical system. So I think we're a long way of thinking of mass producing. When I'm outside of the hospital, I wear a regular surgical mask when I'm outside. I really wear my N95 when I'm at work, when I'm inside with a high concentration of COVID.
Mm-hmm.
There's so many great questions, but the next one I wanted to ask was about antibody testing. If someone asked if you could elaborate a little bit more on on where that stands and how promising that is? Is it worth people trying to pursue getting them?
So there are lots of different antibody tests out there. Initially, it wasn't regulated, so everyone's just producing antibody tests, and they're not great. The it tests for active disease, something called IgM and IgG for if you've had disease in the past. So first of all, it's not a great test. It's still not where we want it to be, and there's wide variability in the test. The second thing, we don't even know if antibodies protect us. So if you have the antibody, are you safe? And it's almost a risk of people feeling too safe that they have the antibody, and then they'll go outside and stop taking precautions. So I am not really ready to actually say the antibody test. I think when we have a really good one and we know that antibodies are effective, and that will be later in the line, maybe later in the year, then we can feel better about it.
And I wouldn't, so the only area where I think antibody testing could make some sense is amongst healthcare workers, just to see if we had been exposed. It wouldn't change anything we do, but it would at least give us a sense of how many of us might have been exposed that didn't have symptoms, for example, which is what you would kind of pick up on, but it's not. I know a lot of patients of mine even are asking for it, and I've been telling them it shouldn't change what you do, so I don't recommend it.
It's a good tool for public health, I think, also for tracking
surveillance.
public health.
Surveillance.
Sorry.
Yeah, totally. Neil Feldman says he has a question that almost certainly thousands of others have. I live alone in a Brooklyn apartment and have been staying home since about March 16th. Have left my apartment only to do food shopping and run 4 to 5 miles, 4 to 5 times a week. Maintained social distancing while I was doing that. Always wear a mask when I'm outside. But over the past week, I went to 2 protest events, about 2 hours each. Always wore a mask, but 6 feet of social distancing was impossible. I continue to feel fine and be able to run, but I know I should be tested. How many days does COVID-19 need to appear in a test? Is it silly to be tested before the virus can be detected? Please advise me and the others who are doing the stay home wearing masks, maintaining social distancing until we felt compelled to protest.
The recommendation is actually to get tested at like day 5 or day 7. The majority of tests will turn positive if they're positive by basically day 7. So getting tested in the first 2 to 3 days could be a false negative in some sense, because you could still have that virus replicating, but not present in the nasal or oral swab. So the best advice would be day 5 or day 7. And there should be enough testing in your communities to be able to do that nasal or oral swab now, if you're that many days past. And that's, again, that's a great example of like, that shouldn't be like something that a community holds hostage as information. That should be pretty clear, and it's national. So I'm going to make another plea, like we just need national, consistent, succinct messages that people can trust, and we don't have that yet. I know we're getting on time, James. I don't know if I see Nancy. I have to answer this. Is there any advocacy amongst physicians for universal health care? There is. I mean, I mentioned my own kind of comments about Medicare for all, and I would say that I think all of us now, including myself who worked on the Affordable Care Act, by the way, I think all of us are trying to understand how can we get to universal healthcare that's actually meaningful. So you can have someone who has unaffordable insurance and can't actually do anything with it, and that's not really access. So I do hope that we can try to, my hope is that a Biden administration tackles this, but that we keep it front of mind and not let it slip away. We might have lost poor James having. Rick, I'm not sure if we're on, if we want to try to end on time so people's Sunday evenings, but I want to make sure that.
Yeah, I can jump in for a minute. There's a question here on the social determinants of health, and should we begin at medical school or residency before going to the classroom and the community? Janice or Kavita, do you want to touch on that?
Yes, Janice.
I think they need to definitely expand that education in medical school. That's really something that we need to understand, that relationship, and that needs to start very early. And currently, some medical schools are starting to adopt that, but by far it's not many. And that's something we definitely need to understand better and realize that we are not in silos.
We need to also most hospitals got very generous tax treatment through the Affordable Care Act to allow for nonprofit tax status, and many of the hospitals in the country are nonprofit. And part of this like health system, Rick, to this point about social determinants, is we need for everybody, we need to identify when patients are coming in social isolation. We need to understand that only 1% of their visit might be in a healthcare institution, and 99% of their health is dictated by the rest of their lives. And so we have to put that as part of what we learn as medical students, but it should also then become part of our practice. And so I'm kind of, you know, I dream like of the day where Janice is a professor in emergency medicine, and I dream of the day where we promote and put people in the highest positions of faculty like professors for tackling those issues, along with bench science and very important research. But I think that for me, coming to connect COVID and what we've been watching over the last several weeks unfold with race in America, I think they're intimately connected, and we have a chance to move ahead. I don't know, Janice, if you agree, but that's what's optimistic to me.
Oh, I think without a doubt. And I think this is a time that we can actually address race, both in medicine. And that's the one common thread here. And it's an uncomfortable topic. It's something that we really need to have discussions about, the race in medicine and just in general society. So it's really important for us to be aware of this.
Wonderful.
Absolutely. James, you back? I think we've got to close in a
I'm so
moment.
sorry about the technical things, but the questions were all so great. There's so many wonderful questions. I guess what I wanted to close with my final question for you guys, and then we'll let everyone go on this Sunday night. You know, there's so much we still don't know. This whole crisis has been so humbling in some ways. You know, you mentioned a second ago about antibodies. We still don't know if you have antibodies, if that makes you immune. Obviously, there's been so much research. You know, we have all of our best minds on this. What are the things about the virus that you kind of hope to still learn, that you're paying attention to and watching for, that that you think will help kind of give us more insight into this and
Yeah.
the
So I'm really excited about some of the readout on clinical trials for like what we call convalescent plasma. I'm hopeful that we'll have some treatments that can help us so that when people are hospitalized, that they don't get as serious as what Janice has seen. So I'm hopeful for that. And then number two, you know, testing. I mean, we just know a lot more. Janice, I forget the statistic you cited about kind of the time when a patient knows that they have COVID and getting to the hospital. But if we can actually quickly identify people sooner, isolate, figure out how to help them isolate in a hotel room if they don't have the resources to do it at home, then we can actually, I mean, James, South Korea, I mean, we can get down to kind of essentially zero. I mean, that's not crazy. So I'm hopeful that we can do some of that.
Yeah, and I'll just finish. I think there are some really great models in other countries that we need to learn from. And I think we really need to focus on community testing to have a better understanding of what's going on in our country as well. So I'm hoping we'll make some inroads.
And I know we couldn't get to everyone's questions, but if the 90-second why and kind of Rick will like indulge us, happy to have people contact us offline and make kind of, I'm a big believer that information is power. So I'm more than happy. I'll put my email. I'm not going to volunteer James or Janice's email, but I'm more than happy. And then if you send me something nasty, just know I'll flag you as spam and never talk to you again. But happy to let people send me a note. I think you know, this is the one thing we can do as a societal good, is like give people facts and give them the best advice we have. So happy to do it for folks who just couldn't get their question in.
So James, another
support rally for the 90-second why. While everyone.
Yeah, thank you. This is great. Thank you for bringing attention to this topic. Yeah.
I know, really. Thanks so much, Rick and Susan and James, for indulging us for an hour.
Thank you guys, and thanks for the great audience questions.
Thank you, and thank you all for joining in on behalf of the Y and for a great panel. And thank you, James. Take care, everyone. Have a good evening.